Would I be right in saying that this has been a baptism by fire, a year of a kind that you couldn't have imagined?
Definitely for a year that we've never expected. And when we thought that we would be having, colonies on the moon, or 2020, we would be on a different thing altogether, to learn to wash our hands altogether again, is a year that is completely unpredictable. But it's also been a privilege to be serving in such testing times. We have been at it, and we've interacted many times before on television and just apart from that as well. So a year full of challenges, opportunities to work, to serve. I think only the best are given an opportunity to serve in such testing times.
Let's come to each of those challenges one by one. The first and the biggest challenge, obviously, has been to deal with COVID. When I look at the numbers, Maharashtra tops in the number of deaths, unfortunately 46,898 this weekend, and cases over 1.81 million. Has COVID, in a sense, exposed the weakness of the public health infrastructure system, the level of unpreparedness, which is why much of it has to be damage limitation?
There are two ways to look at it. Of course, globally, COVID has shaken things around. Healthcare has become priority after a long, long time. And we're looking back at dispensaries, primary healthcare centers, right up to super specialty hospitals and clinics for epidemics. But beyond that, let me be very candid here that Maharashtra has been one state. I cannot comment about other states because I don't know what's happening there. But we have been very, very active, proactive, accountable and transparent about our numbers, about our testing, about reporting every single case that comes as COVID. There's not been a single reason to hide it, because it's something that we have to be honest about, take people into quarantine, isolate them and treat them for COVID. So we've not been, we've not been hiding any numbers. We've not been doing any less testing. It's our focus to get to as many people as we can. Even this whole movement that the Chief Minister started, Maji Kutumba Maji Jawabdari, my family, my responsibility. We've created a whole health map of Maharashtra through a survey with the underlying conditions, with whatever else that people may be going through, and we're putting it into analysis. So not just COVID, beyond that also we're creating a health map for the entire state. So we have been transparent about that, and if you see the active cases, somewhere Maharashtra is in a much more comfortable place than before.
Mm-hmm. I take your point about being transparent, but there is also a sense that one would have thought that Maharashtra would be far better equipped with its public health infrastructure system. Mumbai, Pune, even the districts like Jalgaon, Solapur, each of which experienced spikes at various times. Has that, in a sense, become a wake-up call that unless you invest much more in public health, states like Maharashtra also will suffer?
Absolutely, but this was a healthcare emergency like none before. This doesn't require the regular healthcare facilities that are existing from a long time. What we required for this were isolation facilities. And the short span of time within which the government of Maharashtra really responded to it, creating jumbo centers, isolation facilities, the beds that we increased with Mr. Rajesh Topeji as the health minister, roaming around everywhere, going to facilities, checking on them, with our municipal corporations, with the rural healthcare department, all of this. It has been a tremendous effort, and the whole system of getting oxygenation into our isolation facilities. I think this started off from early April. We are probably one of the first states to move into that. So obviously the challenge was huge, the gap was huge, but we jumped over it. And today, like I said before, we're in a much stable and comfortable position in terms of where our oxygenated beds are in concern, our ICUs, our ventilators, our oxygen concentrators, and the things. Of course, one of the more important things that, the challenges that we faced were two. One was about the incoming passengers from other countries and other states that we were constantly checking and tracking. And of course, Maharashtra is one state that obviously has a lot of floating population moving from one district to another for work and other concerns. And the other challenge we faced in our cities, especially Mumbai, Thane, Pune, and the bigger cities, were, with the type of housing that we have today. Be it the slums, be it the chawls, be it the shared toilet facilities. These are some of the challenges, but even today, the protocols that have been set in by the committees in those housing societies and chawls have been something of a huge study, because a case like Dharavi or Jijamata Nagar in Worli or anything in Thane, these are really the examples that have been not just quoted by the World Health Organization, but all of us, because that is the resolve we made to stop COVID in whatever time we could. And it was only about taking precautions and disinfecting those areas. So I think it has been a huge effort, and it is an ongoing effort. I won't say that the effort is over. As long as the scientific community, as long as the doctors say it's over, we won't say it's over. And therefore, we've also faced a little bit of pressure and criticism in terms of opening up. But we've been extremely slow in that, only because we're only going by scientific advice and the advice of healthcare workers and doctors.